Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. And today, I am very, very pleased to welcome Elijah Carroll. Elijah is a nurse. He's a wound nurse expert, a legal consultant, a nurse educator, a nurse consultant, helping to bridge the gap between administration and nurse. And he's an entrepreneur and he's a speaker. So welcome, Elijah.
Hi, thank you. It's been a pleasure to be here.
It is absolutely my pleasure to speak to you. So the first thing I want to know, as always, why are you nurse? What brought you there?
Well, I'm going to be honest, and some people are going to scoff at the idea, but it was intended to only be a stepping stone. My goal is to be a doctor, and go on to med school, but I'd already started a family. My mom's a nurse, and I can't deny the, there was intrigue in what she did, and I knew that there was enough in the medical field towards what a physician did that it was something I would be happy with. And then one day I worked with a doctor while I was a phlebotomist, and he told me his story. And he had went from a phlebotomist, an EMT, an LPN or a CNA on into an RN. And he was the most understanding physician you could ever work with. He understood all levels of care, and he knew that everything took time. And being an ER doc, sometimes they need results right away.
Yesterday.
He was always patient and calm. So that kind of, was like, all right, that's the goal here. I'm just going to stair step my way up so I can be Dr. like Dr. Draper was, and be that kind of physician. Everybody's going to like me. It'll be good. I'll have a good rapport. And then life happened, and I got my associates in nursing and started working, had a couple more kids, and life was okay. We were good with where we were at. So I didn't go back for a while. Eventually I went back and got my bachelor's, but it took me almost 8 years to do that. So at this point, I'm content with where I'm at as a nurse. And it's good. I like what I do, and I don't have any goal to move forward.
That's the thing about it. For many of us, we get into it, and then it opens up. It kind of grabs you into this thing that you're like, oh, it's probably where I'm supposed to be.
Yes. And I feel that's my, at this point, I feel like it's my calling. I believe I could go on and get my, my MD or my DO, or even my nurse practitioner. I believe those are goals that I could obtain in it. And maybe in the future I will, but I'm happy with where I'm at. Like I said, I feel like I'm where I need to be. I found my niche, and I'm happy with it.
Yeah. What are the biggest challenges for you though?
As a nurse?
Yeah.
Well, this is another one that some people may gawk at, but there's a lot of prejudice being a male nurse, especially a young male nurse. I've definitely had my experience of understanding what it's like to not be the favored one. I mean, to be honest, it definitely is an experience. When I was younger, and historically, I hate the saying, but we've all heard that nurses eat their young. And I so I experienced that as a young nurse, but then on top of that, I was a male nurse. And unfortunately, a lot of older nurses were intimidated by that. I don't know why, because I didn't come in with any other demeanor than what other nurses did as a young nurse, a new nurse. I did have questions, and I know that sometimes upsets people when you have to understand the why and how. But yeah, I still definitely had there were quite a few jobs, especially when I was a new nurse, that there was somebody who would try to run me off and get me to leave that position or leave that facility.
Yeah.
But eventually I've learned to work with it, and I understand the dynamics and where those things come from. And it's not as bad as it used to be. One, maybe because I've aged, I have been in the field for 15 years almost. So that helps, but I don't know. Things have gotten better, I will say. And so hopefully, I hope that's true for younger male nurses as well. I hope that they're seeing a better side of it than what I saw when I became a nurse.
I I can absolutely understand that. My nursing career has spanned more than 40 years now.
Mhm.
And so I have seen when it's gone from pretty much all female. In my nursing class, there were two males.
Sure.
And that was back in the mid 1970s in the United Kingdom, and that was a big deal. It
Mhm.
was a big deal. So I get you, and I get when you say that you needed to ask questions, you needed to understand, because I cannot do anything, no matter how simple it appears to be, if I don't understand what I'm doing.
Right. It's
So I
human
get you.
nature. Yeah. Well, there was actually a study, and man, I wish I could recall where it was from. I believe it was in the United States, but it was back in like the 60s, but it was a psychological study. And basically they took two groups of, I think it was elementary school kids, and told them to wash their hands. One group, they said, why? The other group, they just said, just do it. And who do you think followed the rules? The ones that got the why followed the
Yes.
rules. The ones that were
Yes.
getting nothing were like, I'm not going to do that. Some guy's just telling me to do this with no reason. It doesn't make sense to me. So the child logically was like, I'm not going to waste the time in
Yeah.
washing my hands. It's human nature. Just give us a why. I know it
Just
takes a little effort and a little more work in the conversation,
mhm.
but that's how conversations work. It's
Yeah.
back and forth.
Indeed. Indeed it is. Indeed it is. Yes. So one of the things you say you do is that you, as a consultant, are working to try and bridge the gap between administration and nurse. And that's one of the big complaints we hear from nurses, is that administration does not get it. How do you go about bridging that gap?
So, it's kind of interesting. That's a difficult question to answer in one step. So I'll kind of break it down. It depends on how I'm being utilized in that moment. So if I'm being utilized as an administrative consultant to come in and bridge that gap, let's say the nursing staff has hired me, or the administrative team's hired me to come in and kind of figure out what's going on there. I had a lot of experience as a corporate nurse where I was going into these facilities and I was looking, trying to kind of find out where the problem was. I'm really good at pattern recognition when it comes to people and dynamics, and so give me a little time to kind of observe and see what's happening, and I can give you an idea of what we need to work on. So after a little bit of time, kind of talking with people and things, I do get the picture, and then you have to address it very head on, and that is where sometimes people are like, hey, we really like this guy that we hired, but now I'm kind of irritated with him. But it's because I'm telling them what they don't want to hear. Unfortunately, you have to have those hard truths. So oftentimes, for an example, one time it was the CEO of the company, or of that hospital, was actually the problem. It was a smaller hospital, and it was a little newer of a hospital. But the problem was, is his opinion was practically palatable. It was in the air. The nurses knew. He had the sense that the nurses were very entitled, and that was kind of and the higher pay and the expectations as nurses had were just a bunch of crap,
Mhm.
for a better term. And so anyhow, we had to. But once I identified that, that's when we had to have that conversation. So the guy that hired me, I'm like, I hate to tell you this, but your money went to me telling you you are the problem right now, and this is where we need to fix it. And yeah, and he didn't like it, but he got over it, and he did actually accept it and listen to what I had to say. And at the end, I made various recommendations, like you're going to have to start being more present with the nursing staff out there, not just to go out there and tell them that they need to make sure their drinks are in the hydration station, or
Mm.
to note that we left the scale out in the hallway and it doesn't look appropriate, or it may be a safety hazard. Yes, those are things to address, and by all means address them, but if that's all they ever see, that's not going to help.
Yeah.
And when you come out and you just have this, I don't know, this air about you, you're going to have to find a way to work on that. And so a lot of conversations, and I made recommendations, like maybe you need to be very humble and have an open forum conversation with your nursing staff, and let them let you have it,
Yeah.
and let them be honest and tell you what they really feel, and let them know that there's no ramifications. Said you're still not going to get full honesty, because no one's going to believe there's no ramifications, but you're going to have a few nurses tell you what they think, and they're going to speak for the group, and you're going to find out. And then you have to take that recommendation. If you just blow it off, then we're not going anywhere. Then you wasted your money by sending me here if you can't take the recommendations that are given at that. So honestly, that's a big part of it, is just kind of being honest, being realistic, and breaking down and showing, and showing them, hey, this is where we're at. This is what we need to do, and XYZ.
And that's a big thing that you do, actually, because coming in from the outside and being able to identify and address that problem is very it's one of the things that someone in the situation on the ground may find it very difficult to do. Just because they're there, and they may have identified the problem, but getting it across can be difficult.
Yeah. One, sometimes you're the problem. And that, in that case, that was the situation. He was the problem. And like I said, great guy. I genuinely think as a CEO, phenomenal. He knows how to do his job. He's very good at it. But that humility aspect and that understanding that, although you're not voicing it, it's still present. That was a big point, we had to make. But anyhow, yeah, it's a pleasure to come in and do that, because you really do. You come in and you're a new set of eyes, and you get to pick it all apart, because there's no judgment. You don't know anybody. You don't know the dynamics. You get to learn the dynamics. And nobody puts on a mask. I mean, everybody does put on a mask for the first week. That's why I say typically it's about a 2 to 3 week period before I really can see the truth, because that first week everybody's marshmallows and unicorns.
That's it. You mentioned earlier on when we were talking about this thing about nurses eating their young. I hear that so often. How do you think we can change that? How do you think we can just change that mindset?
That's a hard question.
Yeah.
But I'm glad you get asked that. So the big part that I think is, one, is generational. As that season of nurses, that generation of nurses moves out, I think we're going to see a change, because unfortunately, generational studies, that generation, they were, you just do what you're told. This is how it is. No questions asked. XYZ, that's your job. And that was all there was to it. And now, you have this, again, I think there's more neurodivergence nurses in the world. But two, I think that it genuinely has to do with our generation. We are growing up with generations that we can find the answers to everything immediately. It's obviously exponentially growing that rate. So, but even as a millennial, I bridged that gap between non-technology and technology. I was at 1983 baby. So I really sat in that pocket of knowing the internet and not knowing the internet. So I guess my point is it's so easy to find answers now. We expect answers. So when younger nurses have questions, they want to ask somebody. And if you can't give us that answer, then all we need you to say is, hey, I don't know, but you know what? You can find it out. And those nurses will take that information and they'll go study it and they'll Google it and they'll find the information they need. But, it just being shut down was always such a hard thing. In fact, I had a post, I think on LinkedIn just the other day, about how I had this new nurse coming to me, and she was a student, actually, but I've kind of built my rapport as the wound guy at this contracted facility I'm at right now. And so now I'm getting a lot of new students that we have come up and say, hey, I've got a question about XYZ. And I love those, that opportunity. But, I remember so many times I had those questions, and I would go to my doctor, who was my mentor as a child. And he was just the smartest man I could ever imagine. A small little town I grew up in, Doc Onek was the man. So, and he was very humble and kind. And so I could always ask him a million questions. He would answer them. But every once in a while, he'd say, oh, gosh, I can't anymore. It's too much. Like, we're going to have to stop with the questions and continue another day. And oftentimes we could continue another day. But it's just a matter of, I think, the younger nurses have to be able to ask those questions and do those kinds of things. So I think as the generation changes and that generation of no asking questions moves out, we'll see a change. And then I also think that it's education. And those younger nurses have to be able to stand up for themselves too. And
Yeah.
that can be a little intimidating because sometimes these older nurses can be really scary. I hate to say it, but they just can. And it's not always intentional. I had a physical therapy student come up to me. We're good friends now, but she told me when she was a physical therapy student, none of the students ever wanted to talk to me. And I was like, how come? And they were like, because you got that face. And I'm like, what face? And, I don't know, we've all heard of RBF, and I won't tell you what that means, but that's what I apparently have. So, but that's me in the heat of the moment. If I'm thinking or I'm processing on something, then I've got that face. And so she was like, none of us students ever wanted to talk to you because we were always scared you're going to yell at us. But then we found out you were really nice and it wasn't that bad. But I do think that, yeah, I think those younger nurses have to be able to ask those questions. And when that nurse gets upset, you say, no, I'm sorry. I'm not trying to make this difficult, but if you want me to be able to do my job appropriately, I need to understand what I'm doing and why I'm doing it. Because I really think those questions are the biggest trigger for a lot of the older nurses that are thinking they're young.
Yeah. I agree with you. I absolutely agree with you that it is generational. I agree with, and nursing education has changed. And evolved so much, and many people I notice feel insecure and inadequate, and that comes out, many people who have become nurses prior feel insecure and inadequate and feel as though their experience and what they have garnered along the way does not stack up well against the education that is coming along, which is really not true the case, but they feel it.
That's an interesting point of view. I've not heard that, and that's actually really enlightening to hear.
So you do so much. What would you say? You're a wound care nurse.
I am.
And I see that you spoke in Spain last year, and you're going to where is it you're going to this year?
I'm not nowhere this year. I spoke last year also at the National Wild on Wound Conference in Florida.
Okay. How was that?
Definitely two very different experiences. But they're obviously great. The Wild on Wound Conference is very well put together. If anybody ever is thinking of speaking, I would highly encourage maybe starting there. They're open to all levels of speakers. So you could be new, you can do poster presentations and all of that. And then if you are chose to speak, then, you go to the conference, you get all those CEUs for free. You get to attend the conference, and get all that education, and it's free because they pay that for you, so it's really nice. And it was very well put together. The moderators and everything were all spot on. I just had a phenomenal experience. It was great. Europe was a little different experience for multiple different reasons. One, you've got just different, the way things work over there versus the way things work here. It was a different company. I don't know how long they've been doing it. It wasn't the best organized, but at the end, we made it work, and it was a good conference.
Yeah, and I kind of ask those questions because there are so many nurses here coming along who don't know just how much they might be interested in doing something like that, but didn't even know that they could.
Yes, it was actually, to be honest, they reached out to me for the WOW conference, and they just said, hey, we've kind of seen you on LinkedIn and seen, how active you've been in the nursing world, and kind of reached out to you, seeing if you would like to speak. And so, of course, I took that opportunity, presented my abstract, and I spoke on wound care in the rehab setting, because traditionally physicians are surgeons. If we've got wound care in the rehab, it's typically due to a surgery or a pressure injury or something like that. The surgeon may want to manage. Oftentimes, if it was a pressure injury, the surgeons would hand it off to us and we would manage it. But sometimes they wanted to stay in there. But some of the dressings that they want to utilize just aren't conducive for a rehab setting. You can't do your rehab while you have this huge bulky dressing or this, dressing that doesn't allow range of motion, kind of situation. So yeah, that was what I spoke on, and I think it took really well.
Excellent. So you also mentioned about students. So what advice you give someone who wants to be a nurse?
Um, it's ask questions. That's even when you are facing confrontation, ask the questions you need to ask and stand up for yourself and say, hey, I need to know this if you know, again, so I can do my job well. And for me to be a nurse like you know, you're awesome at what you do. I want to be like you. How am I going to, if I want to do that, I need to know why. You know now, after your 20 years of experience, why you do that particular way of doing your blood sugars, for instance. You know, here's
Yes.
one perfect example. Um, Whenever I check a blood sugar, you know, with an AccuCheck, I always, without a doubt, will wipe off the first 3 drops of blood. Even if that means I feel like I'm milking a turnip and really squeezing to get that blood out, I will wipe the first 3 out before I take my AccuCheck. And I had a nurse that I actually went to nursing school with, that I was precepting. And so she was like, why did you just do that? And I said, let me tell you why. And I
Mhm.
took them up and it's because I worked in the lab and I know that that alcohol, even though you wipe it away off the finger, it's still residually there. And once that blood touches it, even though it's dried by the air, once the
Yeah.
blood touches it again, it's reconstituted and it's reactivated. And so you don't always get an accurate blood sugar. So you know, I said 3 may be overkill, but that's why I do it, because I want to make sure I've cleared all of the blood away from that. So that when I get my AccuDope, I'm not getting any alcohol, which tells me I've got a higher sugar than we actually have.
Yeah.
And she was like, you know, don't you think it'll be a minuscule change if there was a little bit of alcohol left on the end? And I said, you're right. And it probably wouldn't matter if I give them 2 units of insulin as opposed to 1 unit of insulin because of that minuscule change. But at the end of the day, I want to make sure I'm getting the best accurate result that I can get. So that's why I do it. And she was like, okay, cool. And that was the end of the conversation. But she took that, and then I saw her a few days ago doing a blood sugar, and here she was, swipe, swipe, swipe. And I'm, it's my girl, you know. But it was just a simple matter of, again, me taking the time and explaining. So ask questions, know what you're doing, know why you're doing it, because sometimes we need to know. We just
Yeah.
need to know.
Yeah.
So
We need
ask
to
the
know.
question, the hard ones. Even that nurse that you don't think wants to answer it, go ahead and ask her anyway, or him. You know, if
Yeah.
they don't ask it, you ask it anyways.
Yeah. 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 And they may want to. They may
Yeah.
have the face that they may have the face that they didn't that
Hey,
they didn't intend to have, but they may
right.
want to.
And some people aren't bashful. They're going to ask those questions without any regard. And those people I really admire.
Yeah. Yeah. So one of the things that we're talking about a lot these days is self-care. One of the things that wasn't talked about, I have to tell you, when I became a nurse for sure, was self-care. And you know, I think if, in looking back, although it was never mentioned, I think if someone ever mentioned self-care, everybody would go, "What?" So now we're talking about self-care. What does it mean to you?
I mean, so self care for me is being able to take the time I need when I need it. And obviously, you're in the middle of a code, you can't step away from that code because you need a breather. You know, but those little micro breaks that throughout the day are super important, I think. And I think that there needs to be less judgment, and I do think that's changed as well. So again, I may get scoffed at, but I don't see any harm in a nurse taking a couple minutes to step aside and flip through their phone away from the patient care area. If they're in the break room or wherever it might be, I don't care. You know, just don't do it right in front of where everybody can see you.
Mhm.
But you know, if that's what you're going to do for a few minutes to reset your mind so that you can do your job, by all means do it. And
Correct.
that's how I manage facilities whenever I've been in charge. Is that's 100% the way I encourage it. Is I'm not here to, you know, I'm going to do the same thing. You're going to probably walk into my office one day and I'm going to have my phone out and I'll be flipping through Facebook. And that's because I'm taking that break. Don't judge me for the few moments that I took to do that. And I won't judge you when I see you hiding behind the nurse's station, flipping through your phone for a few minutes or texting your husband or
Mhm.
boyfriend or cousin or whoever, you know, whatever you got to do. Those are all fine things, I think. But that's the thing of it is I think we've made the workplace, you know, we've pushed this professionalism, you know, that you can't ever have a phone out. You can't do this. You have to be 100% dedicated to the clock and your facility and your work that you're doing while you're there. But that doesn't work. Not a 12-hour day for a nurse and a 30-minute break in between there. That's not
Yeah.
enough. So
Yeah.
those little micro breaks to me are very important because they do help me to reset my mind and allow me to get back into focus. And then I can go back and do my job in full charge. And I feel like I do it much more efficiently after a little micro break than I do without. So it's things like that and finding things that you enjoy and doing them. I love
Mhm.
rocks. I'm very passionate about rocks. I will go outside and I will go to a creek and I will probably go back with my truck half loaded with rocks in the end. Um, what I can tumble, I'll probably put in my rock tumbler and tumble and then get pretty rocks and then just be happy. And that's what makes me happy. So it's finding what makes you happy and doing it and
Yeah.
find the time to make sure you can do it. Sometimes
Yeah.
that means I have to take the kids with me and things like that. And of course, sometimes they want to go. And sometimes I'm like, hey, we're going to the creek because, we're going to get outside and do something,
Yeah.
but, find a way to incorporate the family if that's what you have to do to be able to enjoy those things. But, you do what you do.
Exactly. Exactly. And I'm so glad you talked about those micro breaks. Um, we often overlook that, how important that is really. We talk about the bigger things, we talk about the vacations and the rest and the meditation stuff, but those micro breaks, as you mentioned, huge, huge. There is a book I read this book so long ago. It's called Sabbath, and pretty much it talks about those kinds of things, that Sabbath is not necessarily just one day. It's
Uh,
5 minutes, or it's whatever, whatever time you take to center yourself.
I've heard
Uh,
that perspective before. I like that perspective of the Sabbath and that, right?
mhm. Yeah, yeah. I think it's pretty cool. It's one of the things that made me stop and give that some real thought
Yeah.
about those times. Yeah, yeah.
Yeah.
So before we go, is there any little gem you'd like to leave us with?
Um, all I have to say is just for all the nurses out there that feel that they're discouraged and they're worn out and they're burnt out. Just know, like you said, I've got many hats and I love them all. And honestly, I'm considering trying to open a home health and provide wound care, locally right now as it is, because I'm ready to kind of settle down and not do as much traveling. I'd still love to do the consulting like I do, and travel when it's appropriate for that. But I think I'm ready to be a little closer to home and get some stuff done here. So I'm thinking about doing a home health. So there's another hat that I may be putting on soon enough. But again, it's all out there. I have the skills. I've built those skills as a nurse. I've got a rapport locally with my wound care knowledge. People know me. They know that I know what I'm doing. So I think now that I've got that rapport and that, and I've got that ability to do wound care like I can independently because I've done it so well for so long, that I think I can now bridge that gap and provide some home care, and hopefully maybe that can lead where I start making my income, and
Yeah,
go from there. But
yeah.
again, it's a little intimidating, all the paperwork that's involved, but it's no different than a filing for a nursing application in any state that you go
You
to. There's
understand?
about
Yeah,
50 pages and there's a lot of questions, but it's all just the same thing over and over again.
yeah.
So if you think you can do it, if you want to do it, if you want to look into it and try it and see if it's your thing, because the nursing world's got so many opportunities. Give it a couple years of trying as a wound care nurse. And if you
Yeah.
really hate it, you walk away from it and you never pick it up again, but you had the experience and you did build knowledge that you will take to the
Ex-
bedside.
exactly, exactly. There's so much knowledge to be gained in whatever area you choose.
Exactly. If nothing else, you walked away from that area and you didn't like it, but you've got the knowledge you built, and it builds a better nurse. It
Yeah,
really does.
yeah, yeah. Thank you so, 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 so very much, Elijah. I really enjoyed this conversation. So
Thank
maybe
you.
we can do it again. I think there's so much more you have to say.
I would love to. It was a very nice conversation. It was very pleasant. So yeah, anytime you just let me know.
Okay, thank you so much. Have a good one.
You too. Thanks. Bye bye.
Bye bye.